what we've tried to do in the design of our program is look to 5 essential components. The first thing we do is we begin with an orientation. So our course is a course that is certified by Middlesex University in London and meets all of the accrediting requirements for the Irish Association for Counselling and Psychotherapy. The course runs approximately over 8 months, essentially an academic year. So it's a pretty short course overall, but it's got well over 100 hours of contact engagement and learning time built into the program. So the first thing we do is we orientate students to that structure of the program, give them a flavor of supervision as a discipline, give them some examples, and we even do some role plays as to what effective contemporary clinical supervision looks like. We'll also spend some time supporting people who, for example, may not have gone to college for a while, who may not have been in formal education for a while, or perhaps may not have written to a university standard. And we really orientate you toward how to get the best out of your learning and how to do the best job you can in terms of assessments and some of the writing activities that you'll have to do as part of your course fulfillment requirements. Once orientation is complete, we begin the first of our 3 core modules on the program. The first module is the theories and skills of supervision. And in that 30-hour module block, what we do is we demonstrate and introduce you to a variety of different models that are highly effective for the practice of clinical supervision. So for example, Hawkins and Shohei have developed a 7-eyed model of clinical supervision, which is essentially a process-orientated model that allows the supervisor and the supervisee to work very collaboratively together in service to the needs of the client and in fact in service to the overall needs of the profession. So in that case, we use models and theories of supervision to ground and anchor the work that we do and set us up later on to beginning some clinical practice as a trainee clinical supervisor. So the first module looks at a variety of models and theories that really allow the supervisor trainee to begin to ground their skills and develop new tools in order to become an effective clinical supervisor. The second module then focuses on becoming a group supervisor. So group supervision operates in many different contexts. One can be an individual supervisor working with any developmental stage of practitioner, whether that's a student practitioner, pre-accredited, accredited, or a senior practitioner in the profession. The second context in which clinical supervision operates is in the context of group supervision. And group supervision is where clearly you have more than one supervisee active in a supervision session at a time. And that can be highly effective both from a cost perspective, also from a learning perspective, and has some advantages but also disadvantages from one-to-one clinical supervision. The third context is organizational supervision. And though there are elements of one-to-one and group in organizations, organizational supervision demands a lot more in terms of the complexity of working in organizational contexts, rather than, we'll say, over private practice. So our group supervision module attends to that case where we would perform or provide supervision where there are multiple supervisees, forming what we describe, or we prefer actually, as a participative form of group supervision. The third module then on our program really looks at ethics and professional practice. So the demands of supervisors these days are pretty rigorous and pretty intense. In fact, within the counselling and psychotherapy domain, clinical supervisors are considered gatekeepers of the profession. So it's up to us to really manage to and help professionals in the field who we become collaborators with in terms of their professional and ethical practice to do that in the most robust way possible. So we learn how to navigate thorny and often quite complicated ethical dilemmas, everything from child protection issues to welfare issues to looking at how we look and work with vulnerable people, people who perhaps are suicidal, people who perhaps have addiction issues, and a whole range of presenting concerns and issues that people, i.e., clients, may bring into the fore. So, ethics in professional practice is very much at the heart of what we do as clinical supervisors. So, it's our role to really help and support our supervisees in being as robust and professionally competent and, in fact, confident as possible. So, they're the three core theoretical elements of the program. And before I talk about the fifth stage, which is the integration stage, I want to talk a little bit about the clinical elements of the program. So the program has the theoretical components, but also has a requirement for skills practice. To accomplish that, we require 50 hours of one-to-one supervision in the duration of the program. So 25 hours of that is delivered inside the program, where there is supervision from the lecturers and the module leaders of the program itself. So we encompass that within the learning environment. But we also require training supervisors to find and undertake 25 hours of external one-to-one supervision with professionals who are already established in their field. So psychology trainee supervisors of psychologists will work with psychologists or nurse practitioners or anybody in that case, in that context, and offer them an opportunity for CPD purposes to participate in some bang up to date clinical supervision sessions. So we will of course support seeking, finding, acquiring supervisees with whom you as a nascent clinical supervisor can work for the purposes of your clinical hours. So 25 hours inside the program and 25 hours outside of the program. For the 25 hours outside of the program, we also require you to have a supervisor that will oversee that clinical work for you. And we require 7 clinical supervision sessions with a supervisor who will oversee your work. And this is your training work as you move through our program. And then finally, once the clinical components have been completed and the theoretical components of the program have been completed, we move toward the integration weekend. And integration is where we bring together the theories and the skills of supervision. We bring together the professional practice and the ethical elements of supervision. And we also bring out the group supervision and really bed in that learning as much as we possibly can. We also, in the integration weekend, help to orientate you towards starting up as in private practice as a professional clinical supervisor. We also look at exploring marketing and branding and other tools that would be very, very helpful in this new online world to get you started. And we also provide some tools and support to help you with applying for accreditation or whatever form that is for your particular profession. We help you with tools and instruments that will help you to complete those applications as seamlessly as possible. So that's a kind of a quick run through the course itself, just at a very high level.